Hi, hello, this is Dr. Shrikant, a specialist in neuromusculoskeletal therapy from Revive Rehabs. Today, we are celebrating the World Stroke Day. It is on October 29th. Stroke is a sudden acute severe manifestation of cerebrovascular accident where the person will get a disability, maybe because of ischemic stroke or hemorrhagic stroke, whatever it may be. It is completely related to the blood vessel. So because of the impairment in the blood vessel, maybe because of a stenosis or occlusion or a thrombus in the blood vessel, which leads to lack of blood circulation to the brain cells, and the brain cells will die. So it is nothing but a ischemic necrosis. So hemorrhagic stroke, if there is a arteriovenous malformation or a cerebral aneurysm or rupture of the blood vessel because of the blood pressure, so this leads to hemorrhagic strokes. So whatever may be the stroke, the golden period is very important. Is 5 hours. So after MRI, we will rule out it is a ischemic stroke or a hemorrhagic stroke. If it is a ischemic stroke, they will use these thrombolytic agents. Okay, tissue plasminogen activator. That injection will help him to come out from the position. So if it is a hemorrhagic stroke, that hemorrhage will lead to hematoma, and the surgeon will go for a burr hole and craniotomy sometimes to decrease the pressure on the blood vessels or brain cells. So they will go for a craniotomy and they will get subcutaneously in the stomach. So cranioplasty, it depends upon the surgeon. So ischemic stroke, hemorrhagic stroke, and there will be one more is a warning sign which is called as a transient ischemic attack. This is the symptoms will resolve automatically for 24 hours. The person will have there is a theme of slogan which is called as a FAST. F is nothing but a facial drooping will be there. A, arm weakness will be there. Yes, slurring of speech will be there. And T, it is time to respond immediately to the emergency department, whatever may be the hospital, whichever may be the department is. So these strokes can be prevented by taking proper care of risk factors. So let me tell you about the risk factors. One is a blood pressure. So blood pressure is lateral pressure exerted by blood on the blood vessels. So 120 by 80 we all know, but with increasing of age, the blood pressure will be increased. So proper controlling of the dietary habits and proper controlling of blood pressure along with the diabetes, controlling the blood sugar levels, which will prevent the stroke, along with the hyperlipidemia and obesity is one of the risk factors for this one. And we have to find out the family history also, which is very important. And one more thing I want to highlight in here is a homocysteine levels. The homocysteine which will causes the blood to clot. So we have to find out the homocysteine level. If you have the increased homocysteine levels, you have to go with a homocheck. That thing will be taken care by the general physician. So these are the risk factors for the stroke. As a physiotherapist, my role is in stroke rehabilitation. That several stages